Welcome to the True Skin Experts Podcast, your trusted source for clear, science-backed information on skin health and beauty. Presented by American Society for Dermatologic Surgery board-certified dermatologists, the episodes break down topics from skincare to medical dermatology and cosmetic procedures, so you can feel confident in your skin health decisions. Whether you're managing a skin condition, exploring cosmetic options, or just curious about the best skincare practices, we're here to empower you with expert advice, one episode at a time.
Welcome everyone to the ASDS True Skin Experts podcast series. Each episode, we invite you to learn about skin health and beauty topics from the True Skin Experts ASDS board-certified dermatologists. In this episode, we will discuss skin cancer, the dangers, and misinformation. May is Skin Cancer Awareness Month, and we are here to bring you important information on this disease. So I'm very excited to be here with two fellow dermatologists. We will soon introduce ourselves. I will start, and they'll go ahead and introduce themselves. So I am Dr. Kemunto Mokaya, better known as Dr. Kemmy, and I practice in Houston at Complete Dermatology. I'm a general dermatologist who does medical, surgical, and cosmetic dermatology. And a fun fact about me is that I'm originally from Nairobi, Kenya. I love traveling. I've lived in 4 countries and 5 U.S. states, from Connecticut, where I trained at Yale for med school, to California, Tennessee, and now in Texas. So when you hear my accent, it's kind of an amalgamation of all the places I've been. So it's now my pleasure to introduce the other dermatologists in this podcast, Dr. Laurin Council and Dr. Maral Skelsey. Let's go ahead and you can just introduce yourselves and where you're from, and then we'll dive right in.
Sure. I'm Laurin Council. I practice currently in St. Louis, Missouri, where I practice predominantly skin cancer removal, but also some cosmetic dermatology. I'm originally from Louisiana.
Awesome. Thank you. And a fun fact about you, would love to know. Or two facts.
I'm an award-winning Cajun chef.
Ooh, I'd love to try your cooking. All right. Dr. Maral?
Mokaya and Skelsey. I am a dermatologist and dermatologic surgeon in Washington, D.C. I'm a clinical professor of dermatology at Georgetown University. I'm focused on skin cancer and also do aesthetics. I'm particularly interested in the leg of surgery, but my main focus is skin cancer.
Awesome. And we'd love to hear a fun fact about you.
My undergraduate major was Chinese history and language, not the usual pre-med, but I managed to make it through medical school somehow.
That's amazing. That's amazing. Well, thank you, ladies. And I look forward to getting to know more about you as we do more of these podcasts. But let's dive into the main topic. Let's talk about skin cancer so that our listeners can know. And, I usually, whenever patients ask me what skin cancers are, I like to tell them that this is when some of our skin cells grow out of control and they form abnormal spots and bumps because they don't follow the normal rules. They're supposed to grow, do their job, and die off. But skin cancer cells stop following the rules. They grow too fast, they pile up, they might turn into dangerous spots and invade the skin. And some of them can be deadly, some of them remain on the spot. So I think for the purposes of this podcast, we'll go over the 3 most common ones. We'll go over basal cell carcinoma, squamous cell carcinoma, and melanoma. And I'll leave it up to you guys. Who wants to tackle basal cell carcinoma?
Sure, I'll do that. Basal cell carcinoma is the most common form of skin cancer. It normally is a skin lesion that grows. It may look like a pink bump or a sore that just doesn't heal or go away. And over time, they slowly get bigger. Predominantly, these occur on areas that see the sun, such as the face, the hands, but you really can get a basal cell carcinoma anywhere on the body, including places that are covered by clothing. Almost always, basal cell carcinoma can be cured with a surgical method, whether that's cutting it out, scraping it off. There are some forms that you can just use a topical cream, even if it's caught very, very early. Sometimes we use radiation to treat basal cell carcinoma. So there really are different ways that we can tackle these depending on where on the body they're located.
Awesome. Thank you for that. And I'm sure we'll go into treatment in some more detail. let's go to squamous cell carcinoma. Dr.
So,
Maral?
squamous cell carcinoma is a non-melanoma skin cancer that's the second most common kind of skin cancer. And these non-melanoma skin cancers, as Dr. Council said, are the most common kind of cancer, period. Skin cancer is the most common kind of cancer. And squamous cells, like basal cells, mostly but not always arise in sun-exposed areas. That means particularly on the head and neck, on the hands, but it's not exclusively in sun-exposed areas. They can also, there's a predisposition to places that have been scarred, so areas of scarring, and patients who are immunosuppressed, either because of genetic abnormalities or because they're taking medications for immunosuppression, also have an increased risk of developing squamous cell carcinoma.
Perfect. And so these non-melanoma skin cancers are really common. Do any of you have any personal history of either yourself or your family members having them?
No, but most of my elderly family members have had at least one skin cancer. They tend to appear later in life, not always. Certainly, you can get a basal cell or squamous cell at an early age, but the majority of these happen in patients age 60 and older.
And unfortunately, we're seeing more and more people, younger people, so developing skin cancers. So it's not the condition of old.
Yes, I mean, I am originally from Kenya, and people who are darker skinned like me think we don't get skin cancers. But a friend of mine in her 50s actually developed a basal cell carcinoma on her forehead. She was only 53, and when I took it off, I thought it was just gonna be a mole, and there it was, a basal cell carcinoma. So we just want to let the listeners know that anyone can get skin cancers. Some people have more risk factors than others, but anyone can get them. And we've already alluded to the risk factors already, but do we want to go over the risk factors of the non-melanoma skin cancers before we get into melanoma?
Sure. So you mentioned a couple things. Age, typically their skin cancers are more likely to appear the older that you get. They're more likely to appear on persons who have lighter skin types. So really fair skin and blue eyes, red hair, those sort of the light skin makes you more susceptible to many skin cancers, although you can get skin cancer with any skin type. And then finally, sun exposure, things like tanning beds and exposure to ultraviolet radiation in the summertime and just from being outdoors, all of those can increase your chance of developing a skin cancer.
Absolutely. Absolutely. So let's go into the treatment of the non-melanoma skin cancers, and we can talk about melanomas. I'd love for you guys to share the most common ways you're treating skin cancer, the non-melanoma skin cancers. And of course, Dr. Maral, you're a Mohs surgeon, so you'll tell us all about Mohs, but we'll start with Dr. Council, then go to Dr. Maral.
Okay, so there are different ways to treat skin cancers. It really depends on the size, the location, and sort of exactly what that skin cancer looks like under the microscope. So, a very low risk superficial basal cell or a squamous cell carcinoma in situ, and that means it's a surface squamous cell carcinoma, those can be treated with a topical cream. It has to be applied twice a day for a series of weeks. Does not work in everyone, but it is one way that we can treat these very superficial skin cancers. Another way that we could treat early skin cancers, particularly on the body, is with a treatment called electrodesiccation and curettage, or cryotherapy and curettage, where we essentially scrape and cauterize these skin cancers. So we scrape them off and cauterize the area to try to prevent them from coming back. It's not perfect. It doesn't work for everyone, but it's a very good treatment for many skin cancers. If the skin cancer is located on an area that's really cosmetically sensitive, like the face or the hands, that's when we might think of doing something called Mohs surgery. And Dr. Skelsey is going to give us a little bit more information about Mohs surgery.
So as Dr. Council said, we might do Mohs surgery in an area that is considered high risk. So on the face, around the eyes, on the nose, around the mouth, on the ears. And skin cancer does occur in the genitalia, in other non-sun exposed areas, and those were considered high risk areas. We use Mohs surgery also for tumors that have recurred, so that have been unresponsive to prior treatment. They may have come back after surgery. those that are particularly large, and those that are occurring in patients who are immunosuppressed, so have a diminished immune system or might have a genetic syndrome. But with Mohs surgery, what we do is take a small area around the margin of the tumor and then look at the tissue under the microscope. So we look at 100% of the tissue to determine if there's any edge that still has skin cancer. And if there is, then the surgeon goes back and takes a little bit more. And so we don't do this for every kind of tumor. It does result in the highest cure rate. There's the highest cure rate with Mohs surgery for all skin cancers, but it's really reserved for those that are in, as Dr. Council said, in these more sensitive, high risk areas or occurring in patients who have an increased risk of having a recurrence or a more aggressive tumor.
Oh, thank you all. Thank you, doctors, for discussing the treatments. So in your practice, the patients, so we've discussed the most common treatments that are known to work. In your practice, have you had patients opting for non-conventional treatments? And since we're out here to correct misinformation, are there things that you've seen your patients do that you definitely would not recommend, that would like people who are listening in to hear and to avoid doing? For example, I have one patient who has a basal cell carcinoma on her nose. She wants to treat it with essential oils and prayer. So every time she comes in, she comes smelling of peppermint oil, and it's growing bigger and bigger every time she comes. But she wants to pray about it and put her essential oils, and she's so convinced it's getting better. And I just want to put a message out there. These cancers are so curable, and the cosmetic outcome is wonderful with Mohs surgery or some of the other or excisions or using the topical chemotherapy agents that we've mentioned. So you don't have to go to non-conventional treatment routes when we have so many amazing ones. Do you guys have examples of patients who've used non-conventional methods?
I certainly have had some patients choose not to treat their skin cancers right away. They are, as you mentioned, maybe afraid of what their cosmetic outcome would be if they treated it. And even when patients are older, sometimes they feel like, well, my life expectancy is not going to be that long. Maybe I don't do this. The problem is we don't really know how long we're going to live. I have patients who are 85 who choose not to treat their skin cancers, and then they come back at 95 and their skin cancer is much, much larger, and it would be much more difficult to remove. So we kind of, at the time of diagnosis, have an opportunity to do a simple procedure to remove the cancer, to stop it from growing. And it really keeps it from becoming a much more challenging problem down the road.
Absolutely.
There really is no benefit to waiting. And the benefit really of Mohs surgery is that it's tissue sparing. So it allows us to take as little of the normal skin as is possible. And while the first goal of Mohs surgery is to take out all the cancer and to result in the highest cure rate, the second is to have the best cosmetic outcome as is possible.
Absolutely. Well, thank you all. Let us move on to melanoma, the big gun. So let's tackle melanoma. What is it? How do you get it? And where do we see it more in men and women? What are the risk factors?
So melanoma is one of the more serious types of skin cancer. When it is caught very early, it is still curable, as basal cell and squamous cell carcinoma are with surgery. But when it's caught in its advanced stages, it is one of the types of skin cancers that can actually get into different parts of the body, such as the liver, the lungs, the lymph nodes, and spread. It looks a little bit different than basal cell and squamous cell carcinoma. Melanoma usually is a dark spot. It looks like a mole that's growing. Not always. It can also be pink. It can be white, but usually these are black or dark brown.
Awesome. Did you want to go over the risk factors or the common sites that we normally see melanomas in?
They can be found almost anywhere on the body, but it's most likely to occur on the trunk in men, in the legs in women, and in the upper back in both. And in people with darker skin tones, it especially can occur more frequently on the extremities. So on the legs, can be underneath the nail, in the genitalia. I mean, there are a lot of instances in which people with melanoma that occurs in people with darker skin types, where it's been diagnosed at a late stage, because they are in areas where people might not examine, and there's also um, less people are not certain that they're don't realize that there is a risk in darker skin types. So melanoma does occur in darker skin, and unfortunately, it's diagnosed at a later stage.
That's absolutely true. So I had a darker skin patient who had actually had a melanoma on her lip. And so nowadays, when I have patients of color, I'm examining the mouth. They find it a bit weird, but I'm like, yes, I have to examine your mouth. I have to check the lids. I have to check the palms and soles. Many people are uncomfortable with me checking the groin area, but in patients of color, melanomas are often seen in sites that are not exposed to the sun. So it's a moment to educate the patients and to let them know, don't be weirded out. We just have to check everywhere to keep you safe so that we don't find things when they're too late. Let's talk about tanning bed. Well, tanning bed use. What would you tell? Because I've been seeing a lot, though I feel like tanning bed use comes in waves. And I'm increasingly in my practice seeing a lot of younger people getting their base tan still. What are you telling your patients to discourage them from using tanning beds?
We know that even just one burn from a sunburn or even one single exposure to a tanning bed increases your risk of both melanoma and non-melanoma skin cancer. It's really important that we try to be comfortable in the skin with the skin color that we have. When people are really, really motivated and want to have darker skin, the self tanners are probably, or they are a lot safer than going into a tanning bed, but I still would even discourage that. And I would say try to be comfortable in the skin that you have, because tanning, whether it's in a tanning bed or just laying out in the sun, can definitely increase your lifetime risk of developing a skin cancer.
And I love that message of being comfortable in the skin that you have. Because going back to my one friend who had the skin cancer, she was also not comfortable in her skin, and she had used skin lightening agents to lighten up her skin color, and that predisposed her. So we have to emphasize to people, just love your skin the way it is. The world is more beautiful because of all the shades of skin. Love yourself. If we all look the same, if we all had that tan look, like it wouldn't be interesting anymore. So we should love our skin and be confident no matter what. So we'd eventually go into melanoma treatment. Perhaps that's something we could discuss next, so that people will just know if they've had the diagnosis, or if they have family members who've been told they have melanomas, what they should expect in treatment options. Would any of you want to tackle that?
Well, melanoma is treated generally with surgery first. The depth of the melanoma, and that's determined after a skin biopsy. So that's the first step, is undergoing a skin biopsy. It's the depth of the melanoma that determines the surgical margin. However, melanoma is staged like other cancers, and depending on the depth, other imaging studies may be obtained in order to determine if the melanoma has spread. Because as we talked about, melanoma, unlike the more common basal cell carcinoma, can spread to the other parts of the body. So in addition to a surgical treatment, there is immunotherapy and targeted therapy for melanoma that's spread to other parts of the body.
Awesome. Yeah, I think you answered this well. And of course, we won't go into any more detail, just to keep it more general. That's perfect. So let's go into ways to prevent skin cancer. Let's go into sun protection, the favorite sun protection tips that you give patients. And let's also go into self-exams, how you tell people to examine themselves monthly. So let's talk about sun protection. If your patients had to tell you to give them your 5 top sun protection tips, what are your go-to tips that you tell them that would give them the most bang for their buck?
I recommend using a broad spectrum sunscreen. So that means something that's going to protect against UVA and UVB. I recommend an SPF of 30 or greater. If you'll do a 50 or higher, that's even better. I recommend using sun protective clothing as well, such as a broad rim hat, sunglasses, long sleeves, swimwear, and things that cover a lot of your body. And on the exposed parts, applying sunscreen reapplying it every couple of hours after toweling and after swimming, and avoiding direct sun exposure during peak hours, which are 10 a.m. until somewhere between 2 and 4 p.m.
Those are great tips, and I feel like they're understandable. So we say reapply sunscreen. Many patients ask us, when exactly should I be reapplying my sunscreen? If I go to work and stay in the office all day, should I reapply at lunchtime? If I'm going to be hiking, when should I reapply? What are the general guidelines you give them on reapplying, Dr. Skelsey?
Sunscreens are actually rated for how long they will last in water. So, for instance, a water resistant sunscreen is rated for how many minutes. So, I always tell my patients to at least reapply it um, after going in the water, and as Dr. Council said, after toweling, after any excessive perspiration. So it's really beneficial to use it about every 2 hours if you're outdoors, and you can set a timer on your phone to remind you, because you're out at the beach or on a boat or playing golf and engaged in something where you're not thinking about reapplying your sunscreen. It's helpful to have some kind of reminder, because no sunscreen is perfect, regardless of the whether it says it's water resistant. It's not waterproof, means it's not 100%. The effect still diminishes over time on the skin. So the general rule of thumb is after being in the water and approximately every 2 hours when you're outdoors.
Absolutely. And what do you tell them about how to apply? I feel like most people skimp out on sunscreen. Like I've had some patients who come and they're like, oh, I have last year's sunscreen. And I'm like, how do you still have that bottle of sunscreen? It's a small one. So what general rule of thumb do you give them so that they can know that they're applying the right amounts of sunscreen and they're not skimping on it? I feel like most people apply it as a retinoid instead of applying it the way it should be.
I do tell people not to leave it in the car, not to keep it out in the sun, and to look at your sunscreen and throw them out at the end of the season, because they do expire. And a sunscreen that's been left in the car is not going to be as effective.
Yeah, and I've always remembered the fingertip unit where you put the sunscreen, like when you bend your finger, from the fingertip, from one of the folds till the tip of of your finger, you should put sunscreen from the fold all the way to the tip, and that should cover the face for appropriate coverage on the face. And then for the body, I'd say if you can cover your face with one fingertip unit, see how the coverage is on your face and transfer it onto the body. It should be the same amount of coverage. A lot of times, whenever patients give me pushback that they'll use the sunscreen too much, I'll tell them, as we've said already, just use the sun protective clothing. That way, there are not as many exposed areas, and you don't have to feel like you're going through sunscreen so fast and spending so much money on sunscreen. So then when patients ask you for a favorite sunscreen, what do you tell them? And when they ask you, or when they tell you that they think sunscreens cause skin cancer and sunscreens are toxic, what are you counseling them on to get them comfortable with the fact that sunscreens are safe to use and are highly recommended by dermatologists?
So I think that there are some sunscreens that we can usually find something that people are comfortable with. So people may not be comfortable with a chemical sunscreen, but maybe they're comfortable with a physical sunscreen. So a physical sunscreen, those are ones like zinc oxide or titanium dioxide. Those will sit directly on the skin, and they are not the chemical sunscreens that some people find irritating. And if you don't want to wear sunscreen, then remember you have the option of sun protective clothing and avoiding the sun during peak hours. So if you wear a hat, sunglasses, long sleeves, pants, you are helping yourself too. Of course, I do still recommend a little bit of sunscreen on your face, even if you're uncomfortable with it, just because you really want to have the best protection. And there are so many out there. Certainly, there's something that you can find that you're comfortable with.
Absolutely. All right, well, let's go to self-exams. So we often tell patients to do self-exams. I will tell my patients, especially the ones with high-risk factors, the ones who've had skin cancers, for the women, whenever they're doing their monthly breast exam, they should do their self-exam. When patients ask you, how exactly should I do a skin check on my own? What should I do? What tips are you giving them to ensure they're doing it the right way?
I make sure that they have two mirrors. I tell them to have a handheld mirror and to stand in front of a mirror and to look behind the ears through the scalp, in the armpits, between the fingers, look without nail polish, um, in the groin, and to get an idea of what's normal for each person. Because I feel like someone's eye and their brain recognizes when something's different. You might not know exactly what's different, but patients are remarkable when they get into the routine of looking at themselves once a month. They begin to recognize when something might be different. And there's a rule that can be helpful called the ugly duckling. And we use that as a general guideline when something looks different from all the rest or is changing in a way that's different from all of the other moles. It means that it should be examined by a board certified dermatologist. It doesn't necessarily mean that something's wrong with it, but it should be brought to the attention of your dermatologist.
Perfect. I love that. I love that answer that you give them. That's really great. Another question or another point to a patient, we get pushback from patients. So some of our female patients love to put on a full face of makeup. I made up myself just for today's purposes. So if you have a patient who comes made up like me and they're like, I don't want to mess up my makeup, what tips are you giving them to reapply sunscreen without messing up their makeup?
I think you can put your sunscreen on first before you apply the rest of the makeup. There are also a lot of foundations that have SPF in them. So you could select a foundation that comes with that built-in SPF. And then finally, you can skip a foundation and just do a tinted sunscreen. There are a lot of sunscreens that have a little bit of tint in them. So you could put one of those on instead.
Absolutely. I love that tip.
And there's powder sunscreen too that you can keep reapplying throughout the day, just as you would any facial powder.
Absolutely. And then there are also some spray sunscreens also that people can also use. So for all of those out there who don't want to mess up their makeup, their strategies. And also for the people, also wanted to caution for the people who feel like their foundation alone has SPF and they don't want to put sunscreen underneath, just realize that you have to put layer after layer after layer of that foundation of your makeup to get the SPF that's advertised. So it's better to use as your primer a proper sunscreen, and then you can put your makeup on that has sunscreen on top of that. So that's great. I mean, our time is almost running out, but are there any tips that you think or any burning tips you feel like we should have passed along to people, to our listeners, our valued listeners who we're glad tuned in with us today?
I think that it's important to know that skin cancer, when it's caught early, tends to be curable. It's not anything typically to be afraid of. If you're diagnosed with a skin cancer, you have it removed, and usually patients do very, very well. But the key is that you have to catch them early, you have to treat them appropriately, and then we have to do our part to prevent them from developing in the first place.
Absolutely. I love that.
Skin cancer is one of the most preventable skin cancers are the most preventable of all cancers. So you can take an active role in decreasing that risk.
Perfect. I love that. Well, thank you everyone for tuning in. I think with that wraps up our episode, but we are excited that this podcast we've started this podcast, and just stay tuned for a lot more interesting topics. To the listeners, if you think you'd love us to discuss, please write in the comments. You can also mention it in our social media channels, and we'll try to address topics that are interesting to you. But it has been a pleasure doing this. Thank you everyone for tuning in.
Thank you.
You.
Thanks for tuning in to the True Skin Experts podcast. If you found today's episode helpful, be sure to subscribe and share with someone who might benefit. For more resources, or to find an ASDS board-certified dermatologist near you, visit asds.net and follow at ASDS SkinMD on all social media platforms. Until next time, take care of your skin. It's with you for a lifetime.